In this section, which we call pain and movement, we've explained some very important things about activity and persistent pain. We all know that we should try to be active and try to get fitter, but this is particularly difficult if you've got persistent pain. This is because most people with persistent pain find that movement and activity is painful. Remember though, from what you've heard before, that it's very unlikely this is because the movement is actually causing damage. And it's now thought that much of the pain associated with activity and movement is because of stiffness and weakness and lack of fitness. On the slide in front of you, we can illustrate this. Here we've got someone with persistent pain. They're therefore doing less active than they normally would do. And this naturally results in stiffness and weakness of the muscles. Because of that, when you try to be active, you get increased pain. And therefore, you have further persistent pain, reducing your activity levels, and again, you have a vicious cycle. Here is another way to illustrate this. So using the same model as Ben did earlier when he was talking about emotion, then we can use this to demonstrate the effects of lack of fitness and lack of flexibility. Here again, we have our patient with persistent pain resting at a level of 5 out of 10. And let's imagine that it's their day to go out and do the big shop. So off they go to the supermarket. They have to reach and stretch. They've got to walk there, push their trolley, get out of their car. All these things require their muscles to be working well and their joints to be moving. But because of their stiffness and lack of fitness, this puts stress through joints that aren't used to moving and makes muscles that are unfit and not used to working generate further pain. So without any more damage, their pain has risen from a 5 out of 10 up to somewhere between an 8 out of 10 pain. So if you're able to break out of this cycle of persistent pain, reducing your activity levels, leading to stiffness and weakness, resulting in more pain, things usually improve. And you can see that demonstrated in the slide in front of you now. So here you have someone who's managed to increase their activity, which makes them fitter and stronger. This actually decreases the sensitivity of their pain system, allowing them to be more active, and so the vicious cycle is broken. Again, we can demonstrate that using the model that we've used before. So here we are back with our patient who's been on their shopping spree. And remember that their pain went up from a 5 out of 10 to a 7 or 8 out of 10 because of their lack of fitness and the weakness of their muscles. So if this individual managed to get their muscles a little bit stronger so they could cope better with the loads required, and managed to get their joints a little bit more flexible so that they can move more easily, then their pain has dropped from a 7 out of 10 to a 5 out of 10 on their shopping expedition. So getting fitter is obviously highly beneficial, but as we've said, it's not easy to do if you've got pain. So here are some important tips. Firstly, start off very, very gently. One of the things that Ben and I see most commonly in our clinics are people who've tried to get themselves fitter and stronger, but they've tried to do a bit too much, a bit too soon, and that's just made their pain much, much worse. Secondly, remember that exercise needs to be regular, and that means most days. Doing a small amount of exercise every couple of weeks will probably just increase your pain rather than actually make you feel better. And you need to persist with things. You mustn't give up. For your muscles to get stronger, for your joints to get more flexible, physical changes need to occur within those structures, and that takes time. So you need to persist with it until you start to feel the benefit. And even when you felt some benefit, you need to keep going, because if you stop exercising, then gradually those muscles will get weaker and the joints will stiffen up again, and you'll be back where you were before. So you need to build up with the time and effort of your exercise very gradually, and you need to make it a long-term commitment. So to summarise the key points that we want to make during this section. Then remember, increased fitness allows you to do more. And doing light exercise is very unlikely to cause damage. You start gently, build up slowly. And remember that only regular exercise is effective. So a long-term commitment is required. Even if you do exercise in this way, then you're still likely to get some times when your pain gets worse. But remember, that's very unlikely to have because of any damage that has occurred. If this does happen, then you can reduce what you're doing, but don't stop it. And as soon as you feel you can, aim to gradually increase your activity levels so that you get your fitness and your strength and your flexibility back to as good as they can be as soon as possible.